work in Scranton, which is, you know, one of the bigger cities in northeastern Pennsylvania. And I had a in-town territory, which was like 5 miles radius. So now I can go up to like 30-35 miles to see a patient. And so there is a lot more driving involved, but it's easier to find a parking spot than in town. That was always difficult. Parking 2 blocks away, running into the high-rise, or trying to find a parking spot there. Here it's more like directions, finding something, although Columbia County is excellent with signs. Every street has a sign here, which is wonderful, and sometimes you get directions like, well, turn left where such and such used to be. And I'm only here 6 years, so I don't know what used to be there, but now we have signs, and a lot of nurses now have GPS, which they just put in the address and off they go. And with the different things that we use too, we have COMED monitors, which is really nice. You're going to get to see one of them. Well, she's an insulin diabetic. That's one of her problems. Another one is she has severe arthritis, osteoarthritis, rheumatoid arthritis, that she is seeing doctors for now. So she does have a lot of pain. That is one of her main issues, is the pain. We got her onto service probably about a month ago. And we're just following her pain assessment and diabetes with her blood sugar, because she's had medication changes, which is, you know, her blood sugars are kind of unstable at this point. I did write out a medication profile for her, a schedule, a chart that she does have with her meds, and she does follow that when she fills her pill box, because she did need help. She did need help with that in the beginning. So now she's independent in filling up her pill box, and any medication changes that are done is just changed on the chart that we did write out for her. So she is able to do that. A little complex down this road, and there's the community center is a little bit farther down, which is very nice. That's where the senior center is here.
Good morning. It is now time to record your vital signs. Blood pressure cuff on your right arm, above the elbow. Tighten it securely. Rest your arm as instructed by your clinician. Please answer the following questions using the yes and no keys. Are you having trouble controlling your blood sugar?
How's it been lately?
High. Yes. Because I have to get...
Are you having any pain?
Yes.
Are you having any difficulty standing or walking?
Not really. I mean, you know.
Haven't had any falls?
No.
Have you had a fall in the last day?
I hope not.
Just ask you that question.
Please remember to take your medications as prescribed by your physician and maintain the proper diet. Thank you for completing your vital signs measurement.
The hospital, everything, completely, you know.
Yeah, well,
all my medicines and everything, they changed.
Well, they upped your prednisone and everything recently.
Yeah, no, I didn't take it one day this week. I think, I don't know what happened. And then Margaret came in, she started me right away on it. Because my hands were swollen and I couldn't bend my fingers. But now they're getting real good. They're getting real good, I think. Good. You know, because they were terrible.
Yeah, it's helping your fingers, but your blood sugars are all
out
of whack.
Well, every time he raises the prednisone, then it's sky high.
Yeah.
But I know I have a feeling she'll change my insulin.
Yeah, we do need to send a report out because it's still high.
It's too high. I mean, I know that.
So when I see my patients in the Bronx, I usually drive to their home just because it's a very large geographic area, and a lot of times it's not that easy to use public transportation to get from one patient to the next. However, when I do see some patients in Manhattan, then I can actually go and take the train to their homes. When I'm working on research projects, that's when I'll see my patients, mostly in Manhattan, and it's much easier than to take the train. So if you can just show me which medications you take and what times you take them.
Okay, these I take in the morning, all of these. I take them once a day.
Which
These I
ones?
take twice.
Okay.
Twice a day, and the rest of them I take one pill once a day.
Okay. What time do you usually take your pills?
In the morning.
What time in the morning?
About 7 or 8.
Okay. All right. And what we can do is we can go over the names of medications, and also what would be really good for you to have is a list of your medications. So whenever you go to your doctor's office, you'll at least have a list and of whatever your current medications are. So I have,
but even though I still have to visit my doctor, it's been nice having someone come out and check me, because I had, I went in the hospital for a cyst I had. I've had several cysts where they had to do a light surgery to open it up, and I got, the last one I had, it put me in the hospital for about a week, because when they did it, I went back in a couple of days for them to check it, and something had went wrong. So they had to admit me in the hospital and drain it and check it out every day and check it and, you know, and keep draining it. And then after I came home, they had the home attendant come back, and they would check it every week.
So that way you didn't have to go back every.
Right.
Yeah, that's right.
So,
that's
so the
nice.
home care nurse came in
Yeah.
to check your.
171? Over what? 78?
78.
That's good or bad?
You tell me.
I think it's kind of bad.
Yeah. What should your blood pressure reading be?
One in the 130, something like that.
Yeah, you want to have it, it's considered high blood pressure if the first number is over 140.
Right.
It's good for you to get a machine for yourself, let's say even a blood pressure machine, because at the end of the day you have to see that it's an investment in yourself, it's an investment in your health.
Right.
Okay, so even though sometimes it might be a little pricey, it's well worth to pay that little bit of extra money for something that can prevent further problems and complications down the road.
Oh, okay. I'm going to check into it.
Oh, good, good.
Yeah, I'll check